Hello everyone, and welcome back to my channel. Today, we have an exciting topic lined up for all our OET learners out there. We're diving deep into the world of modal verbs, and to make it even more engaging, we'll be exploring medical examples that will greatly benefit your OET preparation. So, without further ado, let's get started. Alright, let's begin by breaking down what modal verbs are. Modal verbs are special verbs that express possibility, probability, necessity, or obligation. They add layers of meaning to our sentences and help convey different shades of emotions. In English, some common modal verbs include can, could, may, might, must, shall, should, will, and would. These verbs are essential for effective communication, especially in scenarios like the OET. Now, let's apply our knowledge of modal verbs to medical contexts. These examples will not only help you understand modal verbs better but also improve your ability to handle medical scenarios in the OET. Can and could, discussing possibility. In medical reports, you might encounter phrases like, the patient could have a mild allergy. Here, can and could suggest the possibility of an allergic reaction. Pay attention to the context to determine the level of certainty. Must and have to, expressing necessity. When writing prescriptions, it's crucial to use must or have to accurately. For instance, the patient must take this medication daily. This highlights the necessity and importance of following the prescribed treatment. May and might, talking about probability. Medical test results often involve may or might. For instance, the patient's symptoms might indicate a potential infection. Here, the modal verbs suggest a certain degree of uncertainty about the diagnosis. Should and ought to, advising and recommending. As medical professionals, using should and ought to appropriately is essential when advising patients. For instance, you ought to avoid heavy lifting after the surgery. These verbs indicate a strong recommendation based on medical expertise. To make sure you've got the hang of it, let's do a quick role play. I'll be the doctor, and you'll be the patient. Remember to use modal verbs correctly to communicate effectively. Fantastic job, everyone! Let's recap what we've learned today. Modal verbs add nuances to sentences and are crucial for OET success. Can, could, may, and might express possibility and probability. Must and have to indicate necessity. Should and ought to are used for recommendations. For your homework, I want you to create 3 medical sentences using different modal verbs. Share them in the comments below, and I'll provide feedback. Remember, practice makes perfect.